All right. Hey, good morning, everybody. Our awesome 3 North nurses. I'm Rob Fishwick, manager of respiratory care here at St. Joseph's Hospital. And today I'm here with Steve Callery, your awesome new manager at 3 North. What we want to talk about today is high flow and high velocity therapy. I know you guys are seeing a lot more use of these Vapotherm products on 3 North. And we're using it to treat 2 types of patients. Some of those patients are coming in with hypoxemic respiratory failure, and some of those patients are coming in with hypercarbonate respiratory failure. And what we really just kind of want to focus on today is helping our nurses be more familiar with the equipment and helping you understand how we all work together collaboratively to take better care of our patients. So we'll start first with what most of you are familiar with seeing. This is the Vapotherm Precision Flow. The reason you'll see that it's kind of a little different shape. It has a compressor on it. One of the reasons we had compressors is unfortunately we have no medical air on 3 North, but we have a solution to that. So basically when we're putting this device on, we have a very nice little soft cannula that goes on the patient. It's made of silicone. The reason we sometimes talk about high velocity therapy is that the velocity of the flow going through the device is kind of 3 times whatever the flow is. So that's where we treat our hypercarbonic failure patients. But we use this a lot, like we talked about, for hypoxemic respiratory failure patients. So really when you're looking kind of at the device, it's pretty simple to look at. So you've got your front-facing features here. Up in the top left-hand corner is your liter flow. Over to the right is your oxygen in green. And then the temperature setting is at the bottom. So we'll start here with the temperature setting. It's not uncommon for, and respiratory will set this up for you, will sometimes be between 33 and sometimes 37 to 38 degrees Celsius. Most of the time we end up on 37. Why do we want to do that? Because we want to give our patients heated, humidified gas that's better for their airways. We can adjust the oxygen. It goes from 21%, which is, we all remember from nursing school, is, Steve?
Ambient air.
Ambient air, yep, and it goes all the way up to 100%, okay? And then the liter flow, we can also adjust the liter flow. These devices will go down as low as, sorry, I keep hitting the wrong buttons. These devices will go down as low as 5 liters a minute on this particular circuit, and it will go all the way up to 40 liters a minute. It's very common for us to start a patient at 40. You can hear, actually you can hear the gas going through there. It's starting the patients at 40 and 100%. What we want you guys to kind of understand today is we don't expect nursing to touch the flow at all. We don't want you to do any of that. What we do want to focus on is that if you have oxygen saturation parameters, let's say 88 to 92 because the patient has COPD and the patient's on 100% oxygen, everybody should be weaning down the oxygen on our patients, even if you're only doing it in an increment of 10% at a time. And Steve, tell me if you think that that sounds like a good percentage.
Absolutely, yeah.
10% at a time.
Yeah.
All right. So when you're on this device, you're going to hit the button, this little button here, and it's going to kind of flash at you. If you turn this down, I'm sorry, I got to keep it flashing. By the way, it will default if you don't do anything to it. So if I turn this down to, let's say, 90%, and I hit the button, it's now going to deliver that oxygen at 90%. Okay? And again, you can kind of go back. And if the patient's still satting 100, when the nurse goes back in the room, you can say, hey, let's turn that down by another 10%. Let's get that down to 80%. I think the key here too is just to make sure, and Steve, tell me if you agree with this, is send a quick haiku message to the therapist and just let them know, hey, I saw Mr. So-and-so, he sat in 99%, I weaned his oxygen down by 10%. So I think that communication is going to be really, really important. That's kind of the key components of the precision flow. We're going to take a quick little pause, and then we're going to move over to the 2.0.
And I just want to throw one last
Yes,
little thing
Steve,
in
go
here
right
too, Will. Weaning your oxygen is the same thing as weaning your oxygen in a nasal cannula. Completely within your scope of practice. It's within your scope of practice to place the patient on this device and remove them. One of the few times that you may actually want to adjust the flow, and pretty much the only time I think that would be appropriate for nursing to adjust the flow, is if you're going for a procedure off the floor and you place the patient on a portable O2 device. You can go ahead and set this down to a flow of 5, just so it doesn't make noise and kind of, driving anybody crazy in the unit.
Yep.
But otherwise, we treat this just like a regular nasal cannula. I know it looks a lot more invasive than it is, but just feel comfortable, explore with it, ask your respiratory therapist if you have any questions. If for your first time, reach out to your leadership. But again, it's a fancy nasal cannula, it just helps deliver a higher flow, which we're calling
High velocity
high
therapy.
velocity therapy.
Yeah, or also high flow nasal.
Yes.
Yes.